Thank you, Dr. Yashasvi and Dr. Mehak Thakkar and those who attend the Hindi session. Good evening, good afternoon, and good morning. This is the 2129th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. AVI SHARMA. Let us begin the session with 1 minute silent prayer. I am inviting Ms. Arya to moderate today's session.
Sir, am I audible?
Yes, you are audible. Please begin.
Okay. On behalf of the International Forum for Promoting Homeopathy, I extend a warm welcome to all the respected practitioners, students, and homeopathy enthusiasts joining from different parts of the world for the 2129th day of our uninterrupted daily webinar series. Today's session addresses a topic that resonates deeply with every aspiring homeopath, the homeopathy student's dilemma, finding the simillimum in a world of skepticism. So, as students, we often face questions, even myself, doubts and challenges while striving to understand the true principles of homeopathy. We are fortunate to have an eminent speaker today who will guide us through these important aspects. It is my great pleasure to introduce Dr. AVI SHARMA, Ph.D. Homeopathy and M.D. Homeopathy, a renowned homeopathic physician associated with Hanuman Homeo Clinics with branches in New Delhi, Ghaziabad, Roorkee, and Haridwar. Dr. Sharma is widely respected for his clinical expertise, academic excellence, and dedication to advancing classical homeopathy. His insights have inspired countless students and practitioners. Sir, we are truly honored by your presence today, and we are eagerly looking forward to learn from your experience and wisdom. With great respect and gratitude, I invite Dr. Avi Sharma to deliver today's lecture. Over to you, sir.
Thank you, Doctor. Thank you, Dr. Arya, for the warm welcome. I'm not used to like these sort of kind words, I must say.
I'm a student, sir. I'm a third year
Yeah.
student.
So let me just start with this. Just give me 1 second. Okay. So I hope you can okay. So I hope you can see
Yes, sir, we
the
can see. We
slide.
can see.
Yes, visible.
Yes, sir.
Okay. So basically the topic that I have selected is the homeopathy student's dilemma, finding the minimum in the world of skepticism. The world in which a student who is coming to homeopathy, how he is coming, what circumstances he is actually taking the admission in, and after that, what all challenges he faces. It starts way beyond once he. So basically, taking admission in homeopathy is not the first step. Choosing to take admission in homeopathy is the first step. And before that, there are countless things that come across that happen with the person, the student who is taking admission in homeopathy. So when I start my presentation, I would want to put emphasis on few of the stalwarts that we all know who are the pillars of homeopathy, the pathy that we see as of now. Starting from Dr. Samuel Hahnemann, what we see is a renowned practitioner of modern medicine converting into homeopathy because he did not find the peace, the content that he wanted while practicing. That is how he started his journey to become a homeopath. And once he found the basic law of cure, similia similibus curanter, while translating a book, a manuscript, and that is how he became a homeopath. Coming to Dr. J.T. Kent, a renowned American homeopathic practitioner. He was an eclectic practitioner, and because he was not able to treat his wife, he converted into homeopathy. Dr. C. Herring. Dr. C. Herring was the biggest critique of homeopathy, and he was actually being told by his fellow fellow practitioners to read about homeopathy and to write against homeopathy. But once he started reading homeopathy, once he started seeing the changes, once he started seeing all the things that are happening, that are actually curing the patient, he converted into a homeopath. Dr. Boninghausen. Boninghausen was a baron and a very, very well-renowned botanist in his era. But because of his own suffering and him not being able to the doctors not being able to treat him with the medicines that they have at that time, he looked towards homeopathy and he got better. Dr. Clark, same way, was a very well-renowned allopathic practitioner, but once he got to know about homeopathy while visiting various homeopathic clinics and under the able mentorship of a very good homeopath, he converted into homeopath. Dr. Emil Sarkar, the father of homeopathy in India, he was also a very well-renowned allopathic doctor. And coming from Calcutta, with his emphasis on the British Journal of Medicine, he was also being told to criticize homeopathy. But once he started reading homeopathy and he started developing the taste in homeopathy, he again chose homeopathy over his older school. What do we see? What common thing do we see in all these stalwarts? The first common thing that we see is the orthodox roots from which all these stalwarts were coming from. Second thing is the initial skepticism. Skepticism is always good. I always tell all my students that it is good to be skeptical. Being skeptical means that you would look into things even in a more precise way. Then something happened, a personal catalyst, something happened that changed their view. And then they started looking for the better things in homeopathy rather than focusing on criticizing homeopathy. Next point is the clinical truth over pride. They were not no ego. They saw and they decided what was better. And once they saw the relief that the patients were getting, the cure that the patients were getting with homeopathic medicines, they humbly accepted that and admitted their previous treatments were failing, and then they converted into homeopathy. Lastly, the professional sacrifice. Do you think that these allopathic practitioners of their era turning in towards homeopathy, was that a very smooth process for them? No, absolutely not. The amount of ridicule, the amount of criticism that they had to face from their own peers, it is unimaginable. But then also they did it. So when we look into the roots of when we look into the journey of the pioneers and the roots of our pathy, we find one thing. And the thing is that all of this happened or started when they found an initial interest. The initial interest, when it was seen, that developed into the practice, that developed into the love for the homeopathy. In today's world, India has approximately over 4 lakh registered homeopathic practitioners. When we compare it with the rest of the world, it is approximately 1.5 to 2 lakh. Every year in India, approximately 17,000 students are getting admission in homeopathy. But can we say that all of these 17,000 students are coming to homeopathy because of their sheer will? I don't think so. That is a fact. We'll have to face this. The big red line in homeopathy is that less than 1% students are choosing homeopathy because they want to become a homeopath. Rest are not looking for homeopathy. They're just looking for the tag doctor. That is the harsh reality, and we'll have to face this. Today's presentation will tell us how this happens and why are we letting this happen. So starting from the first point, the first crucial juncture of how this journey starts. This starts when the kid is in 7th or 8th. And he thinks that I want to become a doctor. And for him becoming a doctor, only one thing is there. MBBS doctor. I want to do MBBS. With that comes intense coaching and preparation. 4 to 5 years of gruesome preparation and coaching. After which there is a possibility that he might get admission in MBBS and he's done. But what about other students who have not gotten that admission? They again study and apply for their exam again next year. If in case these students, they do not get an MBBS college, they get frustrated, they get anxious, they do not know what to do because for them there is just one option, MBBS, nothing else. Why is it so? Because there is so much pressure, family, social, peer group, that if in case you want to be successful in medicine, MBBS is the only option. And because of those things, the child, after repeated attempts, if in case they're not able to get into MBBS, they become frustrated, and after that ultimately they choose, okay, I want to be a doctor, let me choose homeopathy. Why so? Because there are very limited options, either MBBS or nothing. So let me choose something that is easily doable, homeopathy. Other things are less desirable. And that is how a kid comes into homeopathy. And that is how his journey starts. But why are children not choosing homeopathy? That is something that we homeopaths need to see. Why not homeopathy? So, why do students hesitate? The homeopathy dilemma. So, when a child starts looking for career options, homeopathy, I think, is the least suitable option for a student. Because every day, every time, everywhere a student goes, a patient goes, they have been feeding a notion that homeopathy is not real. It is a pseudoscience. It is a placebo effect. And that is taking a toll on a student as well. Oh, homeopathy has nothing. It is just sweet pills and it does nothing. It is just placebo effect. And because of this continuous gruesome journey, the emotional conflict, the doubt and hesitation turns into uncertainty, which ultimately makes it very difficult for any student to become a homeopath. I have come from a very rich heritage of homeopathic doctors. I am a 4th generation homeopath in my family, so it was very easy for me to say that, okay, I want to become a homeopath because I've seen homeopathy flourish for n number of years in my own family. But this is not the case with every student who's coming to homeopathy. So why do the students struggle with homeopathy's professional recognition? Because there is no recognition. Let's just face the fact in the most brutal tone possible. No country will allow us to practice homeopathy. Let me rephrase it. No major developed country will not allow us to practice homeopathy. We cannot practice homeopathy freely in USA, UK, Australia, Canada, even Germany. Major international bodies like NHS, like other bodies, they do not consider homeopathy to be a real science. They advise their patients against homeopathy, citing that this is a pseudoscience. All the major global news partners, they do not consider homeopathy to be a real science. And coming to one of the most important aspect, there are very less, I won't say no, but very less peer-reviewed evidences that homeopathy is real. We can say, okay, there are few journals that are getting published that are actually telling us that homeopathy is doing one thing or the another. But let's face it, those journals are not considered at par than like the other Q1, Q2 journals. And if in case me being a practitioner, I am been trying, I had to wait for 2 years to get one article published in a good peer-reviewed journal, because they do not consider homeopathy to be a real science. Coming to the institutional gaps, specifically in India, let us go to a allopathic or an MBBS college and an homeopathic or a BHMS college. You will see a stark difference, and I've seen that myself. And I have been very, very lucky to get education from very good homeopathic colleges. But when we go to an allopathic college, look at the infrastructure, look at the respect that the doctors get, look at the respect that doctors give to their students. But when we talk about homeopathic colleges, the OPDs are empty. There is very limited practical exposure that the students are getting. And if in case somebody wants to say that, no, this is not the case, then I'm sorry. You are not looking at the picture, the true picture. Okay, I become a homeopathic doctor. Whatever the college is, whatsoever my condition was, I became a homeopathic doctor. What after that? The legal and clinical restrictions. I cannot do emergency services. I cannot perform such things. I cannot take such cases. I cannot do this or that. And the most important thing when it comes to a student's point of view is, what is the security that I'm looking at? If I become a homeopathic doctor, what will I do after that? There's a proper set of path that a allopathic doctor will take. I'll do this, I'll do this, I'll do that. But for a homeopathic student, if in case he becomes a homeopathic doctor, a homeopath, if he wants to do good in his life, there is just one option. That is private practice. And private practice is not everybody's cup of tea. Let's be very frank. So, why do the students have trouble believing homeopathy has high earning potential? Because we have been told that. When a student comes to me at my clinic, I tell them, you need to be very certain what you want to do in your life. If in case you want to choose academics, you choose academics. If in case you want to do clinical practice, you do clinical practice. Both these things are very different. I'm a clinician by heart. I can do clinical practice very well. I'm very moderate when it comes to like the academic part. If in case I start taking lectures and all, but clinical part, I have been trained my whole life for that. So that thing actually matters. So when we are talking about a allopathic doctor and comparing with a homeopathic doctor, it is true 70 to 80 to 90,000 rupees per month. This is not the case with homeopaths. Even in government establishments, the starting salary that an allopathic doctor is taking is the main salary that a homeopathic doctor will take after completing his MD and then becoming a lecturer or something. Yes, there are few states that are giving like proper salaries and everything, but this is not the case with everyone. So what are the major challenges that are being faced? The identity crisis, the fear of career security, the emotional baggage from repeated exam attempts. The college I used to go to few years back, I had the privilege of teaching first year students for 5-6 years, and the students that used to come to our college used to tell point blank that, sir, we are not interested in homeopathy. We have just taken this course so that we can have some time to prepare for our next NEET exam. And mind you, they had given exams. This would have been their third or fourth attempt. Ki, okay, sir, if this happens, I'll go do my MBBS or whatever. If it doesn't happen, I don't want to waste my time. That was the thing. What do you expect? Do you expect these doctors to be a proper channeled homeopathic physicians? It is very difficult. I tried my best to just like take them out of that baggage and then make them a homeopathic doctor, but it is very difficult thing. Then comes lack of role models or guidance. How many teachers you see in homeopathy who are willing to invest their time, who are willing to tell the name of the medicines that they are giving? Very few doctors. And after that, the confusion about, am I worth it? What am I doing? And on the top of all, the cherry on the top is the family and the society pressure. Oh, you're doing homeopathy. What will you do? Okay, the student, he gets out of all these things and he enters homeopathy and he enters the first year of homeopathy. What happens after that? He calls his friends who have taken admission in MBBS or BDS or whatsoever college. They're showing, see, reels and all, a court and everything, such huge building and everything. A homeopath student sitting on his wooden desk and all. Inferiority complex. That is the first thing that strikes you. It struck me also. A fourth generation homeopathic doctor, when I was in my first year, I was feeling inferior than the MBBS students. The lack of clarity. What will I do? I've taken admission in first year, but I'm preparing for my NEET exam. If in case my exam comes, I clear my exam, what is the use of reading all this organ and materia medica and pharmacy? Next thing is the language and terminology. This is very, very like evident in like any field, any pathy you go into. But after repeated exams, the child who is so low on motivation, thinking about his career opportunities, and if in case these children who are actually looking for their another NEET exam, if in case they fail again, there is no scope. They think that I'm stuck in something I do not wish to pursue. That is why I tell all the students on day one, If in case you feel that you do not want to be here in homeopathy, leave homeopathy, because it will be very difficult for you once you have invested 6 years of your life. After you have completed your degree and then you say, sir, what to do? Then it becomes very difficult. There's no going back. You're already 28, 29 once you've completed your graduation. What will you do after that? Same thing, the interest and obligation. I'm obligated to take admission in homeopathy because I want to become a doctor. But I have zero interest in becoming a homeopath. Becoming a doctor and becoming a homeopath are two different things. These two are not same. We'll have to be very, very precise in this. Even after this, he completes his first year and he enters his second year. Now comes even more troublesome things. Now, the child who has been formulating pathology, parasitology, virology as a MBBS doctor is being told to do miasmatic evaluation of pathology as per organon of medicine. He was not willing to be a homeopath. Now he wants to do miasmatic evaluation of pathological symptoms. So many students come to me and they say, sir, what is this? And I tell them that is the main thing that you are supposed to do. You're not doing it because you don't know how to do it. You'll need to learn. If in case you want to become a good homeopath, you'll need to do this. Next comes materia medica. Sir, materia medica is so vast. How to memorize it? How to memorize it, sir? And that is the time that I look at a student and then I tell them ki you cannot memorize materia medica. Ki sir, we have to write. Ki that is something different, but you cannot memorize materia medica. Ki sir, our teachers tell us to do that. Ki had this been possible, why would have Henneman and Boningason started making repertories? Repertory began because it is not feasible to memorize materia medica, na? So how to remember materia medica? Yes, that is the thing. How to remember materia medica? You remember materia medica with the patients that you see, with the symptoms that you see in a patient. You see, why did I give this medicine to this patient? Because he had these set of symptoms and I managed to treat the patient with this medicine. That is how you remember materia medica. You cannot memorize materia medica. Other relevant subjects like FMT and all. Sir, what is the use of reading FMT? Yes, it is. It is important. Why is it important, sir? Because you're just memorizing the book doesn't mean that the subject doesn't have n number of things that will benefit you in your future. Every student must understand whatever subject he or she is reading needs to be read in a way that he or she is able to answer, why am I reading this? What is the significance of my reading? I've taught anatomy. So what was the need of reading anatomy? I have to prescribe on symptoms now. What was the need of reading anatomy? If in case a patient points at one part of his body and says, sir, I have pain here. So had I not read anatomy, I wouldn't have known what this part is. Sir, my pain comes from here and goes to here. Had I not known my anatomy and I had not read the full flow of the nerve, I wouldn't have known what nerve it is actually like affecting. So these are the things that a student starts getting the troubles he starts getting into because his foundation was A, not willfully, B, not proper, and C, not in the full extent. If in case I've been just told that Dr. Saab who introduced me, she's a student. So if Dr. Saab can answer it very well, did you read all your books properly? Or did you go for 10 or 20-year question papers? If you did, that's a good thing. But 99% students are not doing the same, no? That is the problem. If a patient comes to you and start telling you that I have certain disease that were not present in the 10-year question paper, what will you say? Oh, I have not read you because you were not important as per my 10-year question paper. That's not done then. Okay. The second year also goes. 2.5 years of your life, you have actually like given to a pathy and you have entered third year. And in third year comes the big revelation that you have to see patients. Come to the OPD and see patients. And that is a complete different animal that you'll have to tame. Because reading a book and talking to a patient are two different things. It is very easy to read a book and yawn if in case you're very lazy, but you cannot do the same in front of a patient. So, the third year tells you the practical approach. If when a student comes and he says, sir, what is the use of reading surgery in our homeopathy? And I tell them, because you have not read the scopes and limitations of homeopathy properly in your first and second year, that is why you're asking this question. Because you'll need to know when to stop, when not to take the case, when the pathology is over your head and you would need the patient to opt for surgery to save his or her life. Now comes obs and gynec. I see so many reels of third year students who go to hospitals for this 7 or 8 days of obs gynec duty, and then they just pose with a baby who they have actually assisted in like normal delivery or something. Ki life is this and that. Some cool, very cool captions. Had you read your FMT properly, you would have known better that posing with such newborns is not ethical. Revealing their face is not ethical. Because patients in India are not well read and well sought, you're not getting sued, or they would have sued the hell out of you. You would need to know. So reading these things, the surgery part, obs and gynec part, the optha part, the ortho part, it is so that you can advise the patient when to stop homeopathic medicines and when to look for allopathic surgical options. And also to know and deal with the patients ethically. Ethical is the word. Do not take any patient up for the ego part. No, I'm a homeopath, I'll treat everything. No, it doesn't work like that. If in case you're going that path, that would turn out to be a very horrible mistake. I'm telling you this. 12 years into my practice, I've learned this. And I've learned this from my father's mistakes, who have learned from his father's mistakes, and who has learned from his father's mistakes. Yes, I was a lucky person, but you can actually learn from my mistakes. I'm telling you this. Okay. The third year also comes to an end with n number of medicines getting introduced in third year for materia medica. The philosophy part of organon of medicine is also getting very complicated with introduction of Stuart and Claus and whatnot. And a student who's not willing to be a homeopath has entered his fourth year. This is the year where I see fear in the eyes of the students. Because now you're about to become a doctor, and now your family also has got some obligations from you that, okay, we have invested this much time and efforts in you. You're about to become a doctor. When will I get my return? Sir, what will happen? You should have asked this question when you were in first year. When a student with the mindset of an allopathic practitioner comes into homeopathy, he's not able to adjust to that thing. Sir, I've always wanted to give allopathic medicines, but how can I give medicines as per miasm of a person? Moreover, homeopathy is very difficult when it's compared to an allopathic curriculum. Because when you're in allopathic curriculum, you just need to read something in a particular way, and that is it. But in homeopathy, you'll have to read it. You'll have to analyze it again in your brain. You'll have to read Organon of Medicine and other philosophical books, and then you'll have to arrange whatever you've understood as per the miasmatic approach. 2 or 3 times more difficult than it would have been for an allopathic student. And you say homeopathy is easy. It is the most difficult science that you could have taken. Because looking at a patient, taking the symptom and just writing medicines as per the symptoms that the patient is telling. 1 symptom, 2 medicines, 3 symptoms, 8 medicines, very easy. But looking at the patient, taking the symptoms, analyzing, miasmatic evaluation, repertorization, and giving one medicine, very difficult, sir. Very, very difficult. Even after this, the student completes his fourth year and comes into the internship part. Very, very difficult part. Why so? Now this is not the problem of the student. Now it has become the problem of the system. The big stipend changes. Sir, an MBBS student, MBBS intern is getting this much stipend, but I'm not getting anything. Even in government sectors, there are some discrepancies that happen with stipends. Private colleges in homeopathy do not give stipends. And after that, the constant mental pressure of what to do. Let's face it, let's be very honest that an homeopathic intern, rather than focusing on the patients, is focusing on the clerical job of how to fill in the forms, how to fill in the pages, how to take the records and whatsoever. This is what's happening all over India. After that, okay, sir, and one more thing. This is for the interns. They get so lazy. Oh, sir, it was such a difficult day. 5 hours of patience, sir. Have you seen how these MBBS interns work? 48 hours of regular, consistent, continuous, rigorous practice. And you are getting sick. You're getting so much work when you have completed your 6 hours of job. This is what I say. This is pathetic. And you're not ready to do anything else. Sir, I've done I've done my duty and I'm going home. I want to rest, play games, watch OTTs. This is not how homeopathy will help you. But these are the problems that a student faces in his lifetime. After that, once he becomes a doctor, what he wants to do. So as of now, there are these like 2, 3 new things that have come into the picture. The MBA in healthcare management and MPH. MBA, I remember when I was a student, people used to do because it was just a degree. But now students are very serious and they see some scope because they'd have zero interest and not interest, I'm sorry. They have zero, what's the word? Belief that a homeopath can earn that much that I can do, I can actually do better with MBA and MPH rather becoming a homeopathic practitioner. That is the truth. Is this how you want homeopathy to pursue? How do you want homeopathy to move forward? So, this basically is all of the struggles that a homeopathic student faces. And how do we avoid these problems? A good mentorship. That is the only thing that can save you. And I'm not asking or saying that I am a good mentor. Everyone around you is a good mentor. Look for mentors at places you're at. Your college, a nearby clinic, some senior who is willing to help you, your JRs, your interns, they will tell you what to do, how to do, when to do. And that is how you do good in homeopathy. So when I speak to students and I tell them, what do you want to do? They say, sir, we don't know. That is not the answer. You should know something, no? That is your goal. That is something that you'll need to figure out. What we can do is that we can help you reach there. We cannot just ask you to sit on our shoulders and carry you forward. We can just give you some tips and tricks and show you the path that will lead you to success. When a homeopathic student comes and sits in front of me and he's in first year and he says that, sir, I'm unsure of what I will do. That is the best point. I can guide him. I can tell him. I can show him that homeopathy has scope, tremendous amount of scope. You can do so well that you have no clue. But if an intern who is coming to me, sitting in front of me, all anxious, frustrated, and willing to do anything just to get some money and say, sir, I'm not sure what I would do. That is like the least favorable time that you can visit a doctor or a senior. What can I tell you now? You've wasted 5.5 or 6 years of your life, and now you're coming and asking. You should have come before. Okay, I might guide you, but not in a proper way. This is like the same thing if in case you're started studying a chapter, you've started your first year and you've asked, sir, how to read anatomy. And you're coming 5 days before your exam and you're asking me how to read anatomy. That is the same thing. It doesn't work like that. One more thing, what actually is lacking? So me being a generational homeopathic doctor, I have seen in my family that my father, he used to sit in front of us. He used to tell us, discuss cases when we were very small, and he used to put faith inside our heart that we have done this with homeopathy. Oh, this patient came, he was suffering from intestinal intussusception. He came from the OT because his diabetes level, his sugar level had risen, and his BP was also shooting. So the doctor was not able to perform surgery. He came to me and I gave this medicine and he got better. These seemed like folk stories to us. But when we started sitting, when we started seeing the cases getting better, that were the building blocks. That was the foundation that actually like inspired me. Okay, if this person can do it, I can also. I'll need to work a bit harder. That is the only thing. I'm ready to do that. But I can do that. This is how homeopath is created. Discussions, constant, gruesome discussions, criticism. I don't know why homeopaths as of now are so much afraid of criticism. Criticism is the building block of homeopathy. Had Hahnemann not been critical about his own writings, he would not have wrote 6 editions of Organon. He would have been very much happy after writing one first edition of Organon, and he would have said, "Now that's done." That doesn't work like that. Had Hahnemann lived another 100 years, I'm pretty sure that we would have been reading approximately 250th edition of Organon of Medicine, because he was so much critical about what he's writing. He used to find flaws in his own findings. That is how you grow. If in case a student, and I'm talking to students as of now, if in case a student thinks that he is lacking somewhere, you will need to come and you will need to ask. I was very lucky that in my internship, I had the privilege of meeting Dr. Castro. I don't know if few of the doctors would be knowing his name. He was one of the most prominent doctors in Punjab, Haryana, and this northwestern North Indian range. And he had he was like another person who brought homeopathy to this region of India, Dr. JBD Castro. And he came to me once when we were interns and we were doing our internship, and he came, a very very old chap. And like how Einstein used to look, the same thing. He used to wear his velcro shirt and everything. He came and he asked few questions, and we were trying to be do like the same thing with what students do when they're in their viva. Oh sir, I know, but I'm not able to recall, sir. I just know, I'll just tell you. And he just smiled and said one thing: teach thou tongue, I don't know. Teach your tongue that I do not know. Because if in case you ask someone, he will tell you and you would know. But if you would just want to just look like a person who knows things, then there is a saying that a person who has half knowledge is the most dangerous person. And when it comes to doctors, he becomes like most dangerous. You would prescribe things that you should not, when you should not, to whom you should not. And any of these things will be disastrous, not just to the patient, but to the image, the responsibility, the ethics that a doctor, in your case and in my case, a homeopath, is carrying. That is the thing that I have actually grown up with. And that is the thing that I would want to tell. I tell all my students. And I feel so happy when I see few of my students, they reach places. Like, we were being told that homeopathy cannot be practiced in Germany and Switzerland. And I am practicing in Delhi only, no? But one of my student now, she has started practicing in Switzerland. That is like something that I dream of. So these are the things, these are the building blocks that we actually should work on. With this, I actually conclude my presentation. If in case you have any doubt, if in case you would want to share anything, you're more than welcome.
Thank you, Dr. Ravi Sharma. You really took us into a different field. That is how a homeopathic doctor can become a famous, one can build his innings uh, by putting simple bricks to the concrete building. That's what we have noted here. And we as homeopaths usually find a lot of difficulties in getting up into top gear. But what you have to look in that, you just look, the advice from my part is that you just look into the doctors who are practicing homeopathy for so many years. And you just visit there. You can see a lot of patients are waiting for the consultation. And the doctor is not a magician, but his intense knowledge and his intense capability to communicate with the patients is the reason why he is getting hundreds of cures every day. We have seen that there were doctors in even in Kerala. There were queues from 4 a.m. To consult the doctor who is coming to the clinic by about 7 a.m. And that particular doctor was died in a heart attack in the toilet because he was so much busy. He has no time to take rest. He was simply doing practice. So that much of practice a homeopathic doctor can build if he has the confidence. What, as you rightly point out, you need to look into a mentor because that is a very good thing. Because you just go simply sit with a senior doctor, you can see how he practices, how he communicate, and how he prescribe medicine, how he give medicine to the patient, and how he collect and how he earn money. And this is a very important factor. Money, you cannot live without money. But in our practice, in the early part of our career, things were entirely different. Frankly speaking, when I took this career, I never had an experience of homeopathic treatment ever in my life. But only after coming over and studying this, and even after completion of the course, also I have not experienced except when I got chicken pox. I was under the treatment of a doctor in my neighborhood. And that's the first time I took homeopathic medicine. And this is what the story. But even after that, what I saw that one of my friend who was just 3 years senior to me was practicing nearby. He has hundreds of patients every day. And then I just visited there and simply sat with him and found that what he is doing. He was simply listening to the patient and simply giving medicine, and or sometimes only single dose, and he's giving placebos, and the patients are coming and telling, Doctor, I am a little bit better than yesterday. Oh, doctor, my disease, my child disease was totally over after taking that medicine like that. But I don't know how he is prescribing. But what I seen in front of me was that he was just listening and he's simply reading his boric materia medica every time and then doing prescribing even within a short span. That was a really big surprise. Then even I have the courage to ask him, Doctor, what you are reading. But after observation, I found that what he was reading, that he was confirming the medicine, that what he is going to give to the patient is the right medicine. It is not the right remedy. It is the exact medicine. That is what he was doing. So this kind of exposure is the need, and what we need is that, as you rightly point out, our professors in the colleges are simply coming over there and teaching, but they don't have that much of practice. That is the reason why the students also having not much of confidence in them. If the doctor around or in that particular college is doing such a wonderful job, naturally the patients the students who are sitting with him will get much confidence than simply you study this case, you repertorize this case, and after repertorization you can find this medicine, you analysis this with your materia medica, you can choose this medicine like that. But instead, you should show the student that what you are doing. and how the results are coming. But nowadays things are entirely different. Most of our doctors are taking documentary evidences, and they are showing to the junior doctors, this is when the patient came to me, this was the condition, and after giving this medicine, this has happened. What I have done this, and how I repeated the medicine. Whether I repeated or I just simply gave medicine like that. Anyway, congratulations. I hope we can have some more. This is one of the subject to be discussed. We need lot of others to discuss. We need you to take charge, and we can discuss this matter for another session.
Definitely, sir, anytime.
Dr. Manoj.
So you actually, like, one of my students, you actually have she actually had the privilege to go to IFPH Kerala session, Kanchan, Dr. Kanchan Upreti. And what we see is, like, we need students, we need doctors, and we need, like, everyone, the fraternity should come together, should actually encourage each other and do better for homeopathy. That should be that should be the ultimate goal. Yeah.
Exactly, Dr. Kanchan, you told us that you are the mentor for her, and that's the reason why, in a span of just 3 years, we was able to visit some 5 to 7 foreign countries, and able to take some classes. Congratulations for you once again for that. Dr. Manoj?
Yes, nice presentation. But what is more important is a combined effort from the society, especially who are benefited with homeopathy. The common man as well as the professionals must work together to percolate homeopathy into deeper level of the community. That's the most important thing the people must know. Another thing is that the investment, that's more important. How much money is investing in homeopathy or any other system that will develop. That's also very important. And another thing is that the students, they should have the interest. We know that we have already this published conducted more than 2,000 days of continuous webinar. But how many students participate there? Very, very less. So the experience or the information is there, but nobody is willing to listen. That's the main problem. So we have to do something to rectify that. Anyway, congratulations for endeavors. Thank you.
Thank you. Thank you very much.
Yes. Yes, if anyone want to talk, please raise your hand. Otherwise, we can go to Miss Aria. Dr. Ambadimam?
Mr. Tanesh is already 9:30. Have to go to the next session, doctor.
Okay, then Miss Aria, you can conclude the session.
Okay, sir. Am I audible?
Yeah.
Yes.
Okay. So, on behalf of the International Forum for Promoting Homeopathy, I extend our heartfelt gratitude to Dr. Avi Sharma for an enlightening talk on the homeopathic students' dilemma, finding the simillimum in a world of skepticism. So, I must admit that today's topic touched me personally. As a BHMS student, I often find myself anxious not only about my own future but also about the future of homeopathy. Like many students, I have wondered whether our profession will receive the recognition it deserves, whether we'll be able to establish ourselves confidently, and how we should respond to the skepticism that we encounter almost all days. So, through your lecture, you have acknowledged these concerns honestly instead of ignoring them. And more importantly, you reminded us that the answer lies not in arguments but in becoming better
Exactly.
physicians.
Yeah.
By strengthening our knowledge, sharpening our case taking skills, and understanding the principles laid by Master Hahnemann, and striving to find the true simillimum for every patient. And the slides you shared on the professional challenges faced by homeopathic students was a reality check, yet your message gave us hope that every challenge can become an opportunity if we remain sincere, ethical, and committed to lifelong learning. I would also like to express my sincere appreciation to the entire IFPH family for organizing these uninterrupted daily webinars. And in case you have missed any webinars, we also have the IFPH Talks YouTube channel. Please check it out. Thank you. Thank you, everyone.
Thank you. Thank you very much.
So over to Dr. Manoj to moderate Malayalam session.